Welcome to Dr. Gore's show. It's my esteemed pleasure to have Dr. Ajay Lodha. He's current president of AAPI, which is the largest Indian physician association in the United States. Outside India, this is one of the largest association. And Dr. Lodha has been very active in the community in the tri-state, and he's a very, very well-known physician and a figure. Welcome to Dr. Gore's show.
Thank you, Dr. Gore. It was a pleasure for inviting me. I am thankful to you for that, really.
Absolutely. And he's been traveling across the globe, getting the word out of AAPI and the physicians of Indian origin. And Dr. Lodha started his medical career, medical school in Udaipur. Then he came to Tri-State where he did his training, and now he has his internal medicine practice in Queens area. So Dr. Lodha, a lot of our Asian population, as you know, we don't like to go to the doctors. We don't want to go till something has gone wrong. If we are good, why should we go? And we did a show recently about why preventive care is so important, because we can pick up diseases early. In your practice, especially it's in Queens area, is it heavily populated with Asian patients? What do you see the common complaints, or what is your common diagnosis to say?
Dr. Gore, Hetal, you said very correctly, as you know, that, ounce of prevention is worth a pound of cure,
Correct.
Definitely. So, definitely prevention is very, very important. And, unfortunately, in our community, we don't see that often.
Correct.
Okay. But definitely the new generation is coming, and the people who are here from last many years, they are following this trend, and we see increased number of people also taking preventive care. Flu season is here.
Correct.
Okay. And we stress everybody to take the flu shots.
Right.
Okay. A lot of people, they say that we get bad reaction to the flu shots. It happens. It's your own body.
Right.
Everybody's body is different. Okay. But it does prevent.
Right.
Like myself and my family, we are taking flu shot from last, I don't know, God knows many
How
years.
many years, right?
I think at least 24 years.
Right.
Because my son is 24-year-old now, and I know when he was 1 year
Wow.
old, he was taking flu shot. Okay?
Right. Right.
So it does help.
Right.
Okay. So then pneumo vaccine.
Right.
Then you are talking about Gardasil, which is
Correct.
which is more common in young people, and this is your field now.
Correct.
Okay.
Right.
So this thing. As internists, we do
Right.
give them also the new vaccine, which is now not new vaccine, but it's coming more common now. Is shingles vaccine now.
Absolutely.
And I've seen quite a few patients get shingles, and it's a very debilitating disease basically.
Right. So I think, Dr. Lodha, you have touched upon vaccination, right? And what you rightly said about the flu, because this is a flu season.
Right.
Let's expand on that.
Okay.
Reason a lot of hospitals, a lot of insurance company are making sure, and especially in my field, pregnant patient, we used to not give them in first trimester. Now we are required even in first trimester to give, and especially in pregnancy is that the immunity is low. If they get flu, they tend to get more pneumonias compared to somebody who is healthier and is not pregnant.
That is true.
So the amount of dollar that is saved by giving one flu vaccine, the amount of time that is saved from absence from work. And that is the reason, right, that especially medical professionals and patients, there is so much importance by the hospital for vaccination. You want to elaborate that point?
It is, since you started the flu vaccine, that in hospital employees, it's mandatory.
Correct.
If you don't take flu vaccine, then you have to wear face mask for 6 months.
Correct.
Until the flu season is there.
Right.
So that is a step in which they are making it mandatory that everybody should take the flu vaccine.
Correct.
Okay. Any health field or which are professional areas where people are working in very narrow environment, the flu vaccine has become a mandatory thing right now.
Correct.
Okay. To make life easy for the patients. Now, as you know that all the pharmacies are giving flu vaccine.
Right.
So you go to pharmacy to buy your medicines and you get the flu vaccine also.
Correct. So access is easy.
Access is easy, so you save time.
Right.
Okay. There are definitely benefits of it. Some of the patients may not tolerate it.
Right.
And it always happens. and they say that they got bad reaction to it. We do see in our practice,
Absolutely.
and I do see a lot of times, but that doesn't mean that I will advise my patients not to take it.
Correct. So what do you think about the myth which goes around flu, that I took a flu shot and I got flu and I'm not going to take it? What do you tell your patients then?
The myth is this thing that the patients think once they get the flu vaccine, that means they are 100% immune.
Correct.
They will never get any cold cough for the whole season.
Right.
So that is a myth, and which is bothering the patients.
Right.
So it doesn't happen. There is nothing 100%.
Correct.
Okay. But suppose if you are taking the flu vaccine, there is a possibility, and nobody's done the studies also, you are getting sick, so that sickness will be less.
Correct.
It does prevent you from getting to, but I don't think anybody can guarantee 100%.
Correct.
So once you catch that cold during this cold season and you've taken a flu vaccine also, this thing goes in the patient's mind that, listen, I got it because of flu vaccine.
Correct.
It's going to tell you everything is not flu.
Correct.
Flu is, if you get common cold, fever, that doesn't mean you have flu vaccine. You got flu.
Correct.
Okay?
Exactly.
Unless you test it, okay?
Right.
It comes positive for the flu virus, okay? Then only you can say it is flu, okay?
Correct.
And that is not, you see in lot of patients who thinks they got flu, but it's not flu, it's common cold.
Correct.
Okay.
So there are a lot of good because of mandatory things, and there are financial benefits to a lot of people, ourselves as patients, as physicians, and to the hospitals and insurance companies. So I think the take-home message: please get your flu shot, right?
Get your flu shot,
and
that's
we
it.
start giving them from like August, correct? September,
Yeah,
whenever
end of
the
August or
availability.
maybe September second week. Generally, we start
Correct.
giving them.
And then I think up to March and April, the recommendation now
Yes.
is to continue
Yeah.
taking it. There is some benefit.
Because they say that the strain which they are making the flu vaccine, but as you said, it's just hypothesized. Okay,
Correct.
they predict that next year this is going to be the
Right.
strain. So they say that still the season is there.
Right.
So up till February, March you are fine, and then you can again take another flu vaccine in the month of September, October.
Correct. So exactly that was the point, because sometimes they say, but I got flu vaccine this year. That's my patient sometimes, if they came say in January, and then if they happen to get pregnant sometimes and we want to give them in October, it is per season. So please remember that.
Yes.
Even though it might be calendar year, if you took in January, this October, November, it's a different season. It's a different winter. You have to take again. So that's a very important thing to see, when they have to take, why they have to take. And it's very hard to diagnose. We have to sometimes culture and see which one, because there was that H1N1, remember?
Yes.
And that time we had to give them 2 vaccines. So it depends what is happening in the area, and keep yourself up to date, or ask your physicians what is the need. And for younger people, they do have the nasal vaccine, correct? Like
Yeah.
little kids are scared of injections.
The advantage of nasal as well as injection is a live vaccine.
Correct.
Nasal is not. Okay. So some people don't want to take that. They want to go for nasal. Okay. But again, the effectiveness, nobody knows.
Efficacy is right. We don't
We
know.
don't know that how much effective is nasal as compared to when you take the injection.
Correct.
So that's what is basically.
So preferable is to take injection. And if for some reason you can't, I think some people with egg allergies and stuff also, they
yes,
might.
that's what I want to tell the viewers, that egg allergy patients cannot take flu vaccine.
Correct.
Cannot take flu vaccine.
So then they can take nasal, because the
For them it is nasal.
preservative is different. So they could
because
take.
it's not live.
Correct.
So that's why they can take nasal.
So there are some adults who might need nasal because they can't take, because either they are scared of needles or they are allergic to egg, but we're not sure how much is the efficacy. So flu vaccine is very seasonal, right? But then, as you mentioned, that as we get older, or there are certain diseases which make some people more prone to pneumonia, shingles, and so tell us, what are the indications to give pneumonia vaccine, the pneumovax, shingle vaccine, Tdap, the pertussis, diphtheria, those vaccines, and then we can go through, the Gardasil. But tell us in general, what are the indications?
Let's talk about pneumonia vaccine.
Correct.
Again, it will be also is a myth.
Right.
First of all, does not give you 100% cure.
Correct.
100% prevention, not cure, 100% prevention from pneumonia, because you understand pneumonia vaccine is made of 23 strains.
Right.
Okay. We don't know, you can get those 23 strain vaccine, but you can get pneumonia from the 24th.
24th, right.
That's what it is.
Your luck, right?
Your luck. But it does prevent. Okay. It is recommended in everybody more than 65 years of age, plus patients who are immunocompromised.
Correct.
Okay, patients with diabetes,
Right.
you know, lung disease,
Immunosuppressant.
immunosuppressants, lung disease, especially patients with asthma,
Smokers,
or
COPD.
smokers, and you know, cancer patients. For them, there is no age bar. Okay,
Right.
it should be taken every 6 years.
Correct.
Okay, and sometimes in some patients you may get like, you know, one day of very light mild feverishness. So generally what I do to my patients when I give them pneumonia vaccine, I tell them just take 2 Tylenol also. Okay, when you go home just take 2 Tylenol.
Correct.
Otherwise, you know, the immunity is there for 6 years,
Right.
and you know, you are fine.
Right.
Okay,
I think the
but
patients with splenectomy also, they need to
for
take
patients with splenectomy, they have to get pneumonia vaccine every year.
correct, because they
The
cannot
reason, I think some viewers may be thinking that why.
right.
The reason behind is this thing that spleen is a filter.
Correct.
It filters the blood.
Right.
Okay. So if you don't have spleen, the spleen is an organ which is in your left side,
Correct. Just
Okay.
below the or behind the stomach is this
Just-
small.
just below the rib cage. You know,
Correct.
it is small organ,
Correct.
like a kidney shape. You know, like a bean shape.
Mm-hmm.
I will not say bean, like oval structure.
Correct.
No, the spleen. And what does it do? It filters the blood.
Right.
So what happens that in patients with splenectomy, the filtration of the blood does not take place,
Correct.
and pneumobacteria, what happens that it doesn't get filtered, so
They are more
there's
prone
more
to get-
chances of getting pneumonia.
Correct.
So that's why these patients should take pneumo vaccine every year.
Correct. So, spleen, as Dr. Lodha just said, is a small organ very close to stomach and between stomach and the ribs. Some people who have had trauma, some people who have certain diseases and certain cancers, that the spleen needs to come out. And spleen is like a filter, as suggested, and it destroys also. It's one of the hemopoietic system. That means it is producing also some blood cells, some WBCs, and it takes out the old cells and refreshes them. The pneumococcal bacteria, that the capsulated part, it doesn't get filtered through spleen. That's why if you had any surgery and if you know your spleen is out, people who have it out will know what is spleen, and they should go to their doctor every 6 years. You know what I see, that they will take at the time of surgery, the physician will remember, they'll give them, but the follow-up doesn't happen. Every 6 years to go back to get
Every
if
year.
you are every year. If you are a younger person and you don't go to the doctors and then you forget that your spleen is out, you need to take it yearly. So that is very important to keep that in mind. Apart from pneumococcal, you know, shingle, I think is
very
pretty
common, very
debilitating also,
Very
right?
discriminating. The biggest disadvantage, you know, shingles, nobody knows the cause.
Correct.
And I want to tell the viewers this thing also, that, you know, shingles is from herpes virus.
Correct.
There are 2 different types of herpes virus. One is good and one is bad.
Correct.
Actually, both are bad because both can produce disease. But
Correct.
good and bad means that one remains in your one.
So
one
immune
is very-
system and nerve, right?
One is very bad for your body.
Mhm.
Okay, and it is sexually transmitted.
Mm-hmm.
Okay, and one herpes which you get, rash on your face, on your arm, sometimes on your lips.
Lips.
Okay, so that herpes is not because of the sexually transmitted disease.
Correct.
Okay, and that anybody can get it,
Correct.
because 90% of people do harbor herpes virus.
Correct.
Okay, most of the people had
By
herpes
touch, by
anything, you don't know, you're going in subway, somebody's herpes, you just get
Correct.
it. Okay. But who gets it, that depends on immune system,
correct.
your
How you
stress
fight
level,
that? Mhm.
and sometimes your, you know, extremes of the weather, any change in your body milieu or
Correct.
environment, or lot of tension
And fever, right?
And fever.
Like the oral sores, we call
Oral
fever
sores,
sores
yes.
sometimes. because-
can reactivate that virus which is in your body already
Correct.
there, and you get herpes.
Right.
Okay. Cold sores are okay, you know,
Right.
you can treat, but when you get this herpes rash,
Mhm.
that can be sometimes very bad, and the pain, it is a very burning type of pain,
Correct.
can last for 2 to 3 years
Right.
also. Okay.
So the
So-
shingles virus, as it
Right.
is called, the herpes, as Dr. Lodha mentioned, it's 2 types: herpes type 1, herpes type 2. And most of the time, and now there is some changes also because of the way the sexual practices are. Type 1 is just not oral, you know, you can see transmission oral, genital. So we see type 1 and type 2 mixed up at times, but type 1 is the one which is resting on the nerve endings, and especially around the rib cage. And when there's a reactivation, as you suggested, either your immune system is down, or
your immune system may be good.
Right.
It may be good. Still, you can
Stress,
get it.
right? Any stress level,
can do.
all those things, all those changes where the virus has an upper hand is going to start making blisters, pain, and even after the blisters are gone, as you said, for years, that pain in that nerve ending is really debilitating. And people who have if you suffer from it, you'll know how painful it is. And to prevent that, we have recommendations, correct?
Yeah, we have now herpes, vaccine.
Correct.
Okay. Recommended to anybody who wants it. Okay.
And also at 65 and above.
65 and above they should take it.
When they come to their physician's offices, they should be really counseled.
It's a very expensive vaccine. A lot of insurance don't cover it. Okay. Sometimes you may have to end up paying part of it or fully by pocket. Okay. It's not a cheap vaccine. So that is another drawback, why people don't want to take this vaccine because of the cost factor.
So even if you have insurance or Medicare at that point, if you have supplementary insurance,
Medicare will cover it,
correct,
Medicare,
right? So we will try to get that covered.
Right.
But if you are like in nursing home bound, please make sure you take those.
Yes,
because I think the geriatricians have paid a lot of attention and have emphasized the need for it. So if any one of your parents or you as a viewer are listening, remember when you go for your annual checkup to ask about this vaccination, the pneumonia vaccine, the shingles vaccine. If it's a flu season, take flu vaccines. We cannot emphasize why they are so important, because as we get older, all these diseases can take upper hand. And apart from your routine blood pressure, diabetes, counseling, your physicians are supposed to take care of prevention by vaccination. As we talk about, mammograms and colonoscopy, vaccination is a huge amount of important thing in the health maintenance. We're going to take a short break and we'll be right back. We've been talking with Dr. Ajay Lodha, president of AAPI, and he's in practice in Queens area. And the number and his website are on the screen. So anybody who would love to see him, please call his number. We'll be taking a short break and we'll be right back. Welcome back. Today we are talking to Dr. Ajay Lodha, president of AAPI, and he's been in practice in Queens area for more than 20 years as an internal medicine practice. His number is on the screen. And so far we've discussed about prevention by vaccination. This is a flu season, don't forget, and other vaccination as we discussed. So going back to your office practice, right? You have checked this patient, you've told about the vaccinations. What else do you suggest depending upon the age? Somebody who is in 30s and 40s and somebody who's 50 and 60s, what are the different recommendations?
I think, the most important thing by which we can prevent, and it's proven, and it's very effectively, and which I see a lot of ignorance in our community, is mammogram.
Right. Oh, absolutely.
Very, very important test. And it's a treatable disease.
Correct.
If you detect breast cancer,
early detection,
you're 100% cure. Okay. And if you don't detect it, it goes into later stages, then the mortality is high. You may live or survive another 20-25 years, but you don't know. Okay.
Correct.
So the recommendation to all, there are different criteria.
Correct.
But for a normal patient with no medical history in the family of breast cancer, no other immunocompromised. Immunocompromised doesn't come for breast cancer, but most important thing is family history of breast cancer.
Family history. We do go through, like as OB, we like if
you go through also,
if they haven't had pregnancies, they have had long, menstrual history. That means they had early menarche, late menopause, they haven't had IVF, ovarian cancer, colon cancer, the Lynch syndrome, the BRCA and all that, which in our community I have to like really push them.
Really push them, really push them.
So that's one of the big
big dilemma.
And colonoscopy, I have had patients where I ask them and they say, oh, but we are vegetarian. And I have had patients who are vegetarian and have colon cancer. So that's something else also, right?
Yes,
you
definitely.
find it hard for people.
So, breast cancer, the recommended age is for a normal patient.
Correct.
Is 35 years.
Right.
You should have a baseline mammogram between 35 to 40 years.
Correct.
Then every year after 40 years until you are 65 years of age.
Right.
Okay,
and later now, because
now later also, because
the survival
is more now, definitely. So age is not a criteria.
We are living more longer and longer.
Life, definitely.
So absolutely, but
okay. But if you have a family history, your mother or sister, or your have breast cancer, then the mammogram is suggested much earlier age.
Correct. 5 years before the earlier age of the relative.
And in some before also it was indication that if you have a very, very strong family history, then they were used to do prophylactic mastectomy also.
Right.
Okay.
We have some changes, luckily in this country, because we do the genetic testing and the carrier screening. MRI has changed how we manage them as well, to early detection and chemo prevention. Now, apart from mammogram, do you recommend the colonoscopy?
Definitely colonoscopy also, everybody, and it's mandatory, not mandatory, but it is recommended.
Correct. Okay? Very strongly
recommended, and very strongly recommended that after 50 years of age, everybody should have at least one time colonoscopy.
Correct.
And the recommendation is that every 10 years you should have colonoscopy if a colonoscopy is completely normal.
Right.
If they find there's some abnormality or too many polyps or something, then even depends on the gastrointestinal.
Correct.
Your GI specialist, and your condition of the health. It may go over 5 years also, 6 years also. It varies. Okay.
Right.
Again, if you have a strong family history of colonoscopy, then there are some diseases in which they prefer colonoscopy even at 20 years of age also.
Right. Like you have ulcerative colitis and other diseases which makes you prone for colon cancer, they do it earlier. Now, I think apart from the prevention, one thing that I find it hard, especially with our population, and I want your input in it, is diet.
Yes.
I think whatever said and done, we have patients who are diabetic, hypertensive, and some of it is my colleague physicians my friends that I know they have diabetes, and we party together and they are like eating everything.
That's true.
So how do you counsel your patient? I think diet is such a difficult thing.
We just hammer them. That's what I can tell you. And as you know, doctors are the worst patients.
Correct.
Definitely.
Absolutely.
And as you said very clearly, and it's common with everybody.
Right.
You see a lot of your patients are your friends also. You go to their parties and they have very bad diabetes, and they're eating everything.
Correct.
Okay. So that is a very common thing which we see all
cholesterol, which is
all
high.
The time. High cholesterol.
And they have high cholesterol, and then like I love Mahabharati food, and there's so much fried food there. And I'm like, okay, we are eating every day. It's not like once in a while, like you have parties. Now holiday season comes, and how do you get them to like get that message across?
You just have to hammer them. We just keep on hammering them. Every time they come in, we tell them, we show them examples, and it is changing definitely.
Correct.
Okay, but the things are also changing. If you look at some studies, they are telling that butter is no longer a dangerous thing now anymore.
Correct.
Okay.
Absolutely.
Yeah.
And I have something to share after that a lot of times, remember when we used to tell patients have high calcium or have high doses of calcium, right? And then the trend goes now high doses of vitamin D, then it will be vitamin B12. And I think I've said it so many times on my show, and I keep repeating the same thing. Don't go from one trend to the other. That's my recommendation. People used to go Atkins diet, they ate full-time fat, then they went to no carbs diet, and I think the pendulum keeps shifting. Yes. I think everything in moderation.
Everything moderation should be good, and I'm telling you, the study was done
right
in one of the European countries, and what was happening that the parents, they were keeping even their children, newborn children, very strictly low carb diet.
Right.
So they found that there was no development in them.
Right.
Because I want to let the viewers know that your brain is 90% made of fat.
Right.
It's all fat there. Okay. So those children who were growing, they were not giving them fatty diet, their brain never developed.
Correct.
Okay.
So first
So-
1 year of actually life, they have done exactly the study that the lipids do get, surrounding the nerves, and the
Yes.
stimulation is very important. That's why breast milk is much better for the neurological development. And I find, like, a lot of time I tell my friends who are non-Indians, they say, how come you Indians are so bright? I said, it's our diet and it's our, the way, right, we do things. And, because for, we don't have much time, but I really want to point out about your work that you're doing as AAPI president. You're not only doing work in USA, doing, education and awareness, but I think now the global health, right? You're traveling to India, you went and met a lot of ministers. Give our viewers some idea what, as we as a physician community doing.
AAPI is a great organization,
Right.
and we are proud of that. I'm very proud that I'm part of it, and I feel very honored that I'm the president of such a big organization. It's second, after AMA.
Right.
It's the largest ethnic organization in the country right now.
Correct.
And every 7th patient in this country is treated by an Indian physician.
Absolutely.
That's pride for all the Indian doctors, and we are doing a lot of things. And every year, we do one conference in India also,
Right.
where a lot of physicians, surgeons, different specialty people, they go to India and on their own expenses, with their own time, and we do a 2 to 3 day seminar type of thing where we go on different common types of diseases. We invite Indian counterparts also from India. So it's a joint venture type
Right.
of thing.
It's like exchange of
ideas.
ideas.
Ideas, and we develop a white paper present to the government. And AAPI has done several projects in India, and they've started new fellowships in India, which India did not have before.
Right.
And this is our 10th Global Health Summit.
Wow.
And we hope to work more and more with our Indian counterparts, and this is like a way of giving back to your country.
Absolutely.
Because our country has given us so much. I did my medical school in
Right.
less than $1,000.
Right.
Okay, so now it's my time to give back to my country.
Correct. So as viewers, just to give a little bit of our usual medical talk, I think we physicians do feel sometimes very obliged, or we feel that we cheated our own country. So this is our way to pay back to our India, and we feel that not everything we do is for money. We do want to do things to improve health globally, wherever our Indian counterparts are, and we do a lot of work in United States for general population as well as Indian patients and physicians. We can talk for hours, I think, Dr. Lodha, but thank you so much, because I know you've been traveling globally, and your practice and all other work that you do for the community, as well as for AAPI as a president right now. So I really thank you for the time. And viewers, you've been watching Dr. Gore's show. Until next time, goodbye.
Thank you.